Hi there.
Hello,
Everyone is entering.
everybody. It's Martin from Austria.
Hello, Martin. How are you?
Hi, hello.
You all, and here you all. How are you?
Hello, Martin.
Hi. Hello.
Hi.
Hi, Martin.
From Colombia.
Hi, I'm Jacques from South Africa.
Wow.
Hello, Martin. It's Alito from Oregon.
Hello, Mr. Wagner.
Hi, this is Subhash from India.
Hola from Germany.
Good afternoon from Madrid.
Hello from Miami.
Good afternoon from Budapest.
Hello, everyone. Hello, everyone from Scotland.
Hi, Eli from Israel.
Yeah, Michael.
Hello, all. Ravi from
England.
Good afternoon from Latvia.
Hello from India.
Good afternoon from Oregon, the United States.
Wow.
Hello from Miami Beach.
Good morning from Atlanta.
Good morning.
Hello from Kentucky.
Guys, I'm breathing now.
Good morning from Atlanta.
Morning.
Wow, and, you have to see the numbers coming in. It's amazing.
Good morning from Atlanta.
Good morning from Costa Rica.
Wow.
Good afternoon from Germany, Trier.
Coming from Colombia.
Colombia, wow. And I see India here.
Yeah,
Hello
I am
from
Sankara. I'm
Innsbruck.
from India.
Wow.
Hi, this is Ravital from Israel.
Hi, it's Eliana from Denver.
Hello
Great.
from Italy.
Hello from Chile.
Hello, everyone. I'm Bernie from Colombia.
I'm from Yama.
Wow.
Hello, I'm from Carinthia from Austria. Hello.
Okay.
Hello. Good evening I'm Shankar from India.
Guys, we have 50 more coming in. This is crazy. I never participated in a webinar with so many people. So let's bear with me till everybody gets in.
Good evening
This
to all.
is exciting, guys.
Hi, Connie. Hi.
Hi, Sabrina Cohen.
Hi, Alan Brown. I don't see you, but I hear you.
This is exciting.
Shalom, Ronnie.
Hi, Ron.
Good thing I'm not going to ask you guys to stand up and see what you're wearing on the bottom part. Only if you guys see smiling.
I can't stand up, so don't worry about it.
Hello, Sabrina and Alan.
Hey, Jamie.
Hi. Who's that?
From Yama.
זה אומר שעוד 67 צריכים להיכנס?
Sam Evans from Atlanta.
Okay, Yuval will give it one more minute because people are coming in. I still see about 70 in the waiting room coming in one by one. We'll wait for 1 or 2 more minutes and then we will begin. Okay, guys?
Okay, thank you.
Meanwhile, take pictures. I want to see the social media with this vision that I see now. People from all over the world here for the right reason. Perfect. So, Atali, if I begin, people can continue to come in, right? Okay. So, Yuval, are you ready? You're my boss, yeah?
Your internet just gone down.
Ron Pettit, how are you doing?
מה, את יודעת יותר טוב ממני?
לא משנה, אל תקרא לה.
לא יודעת. אני חושב שאנחנו בינתיים בתוך. מה את, קחי, מה את לא ככה?
Okay, guys, are you ready?
Okay, we are beginning, guys. Tali, you're the boss. Can I get a green light to start?
Yeah, the green light.
אז תורידי לי רק את זה, את המסך הזה, ונתחיל. Okay, hi to everybody. I am Michal Rimon, and I don't want to jinx it, so whoever saw me in previous conferences or webinars, I always begin with the same sentence. I am the proud CEO of Access Israel, proud of the organization and its achievements for the last 20 years in Israel and abroad, proud of the projects that we're doing, making accessibility a common word in Israel, and it enabled us to really promote the goal of inclusion and of improvement of quality of life for people with disability and the elderly. And most of all, I am very proud of the people in Access Israel that make it all possible, especially during these difficult and challenging times. Today, as you saw just now, I am really thankful and proud for the amazing partners and the international network we have created together. A network of friends that share the same values and the obligation to the cause, joining together, making inclusion and accessibility a reality, and by this, promoting so many of the UN's SDGs aimed at making sure our futures leave no one behind. And I hope that the more than 400 participants that's registered, and now I see about almost 300 either in or in the waiting room, from 60 countries from around the world will join our community and do good together on a global level. The ability to reach out to leading international organizations, experts, colleagues, commissioners, leaders, technology companies, businesses, and more is priceless. The network makes us all understand that while we might live in different countries, climates, environments, cultures, we all share a common fact. We all have our biggest minority, which are people with disabilities and the elderly. They are our parents, our siblings, our neighbors, our employees, and our friends. These people who are part of us face challenges connected to their disability and aging, but we as a society need to make sure we don't burden them with additional challenges stemming from lack of physical accessibility, lack of information from service providers to provide accessible sensitive services, lack of accessibility of technologies that are used by all of us, and most of all, lack of social acceptance as equals. So, on this note, I am very happy to welcome you all to the first international webinar on accessibility and inclusion, this time focusing on the COVID-19 coronavirus. Each one of us will use the terminology they feel most comfortable with. This event is a partnership of our best friends from the network. First of all, Zero Project, we will hear them shortly, Valuable 500, ONSE, IAAP, Phaser, Google, Enable, G3 ICT, I'm going to say it, Klaus, in English, I'm sorry, Austrian Association Supporting the Blind and Visually Impaired, Microsoft, and more. It's an honor to work with you. The idea is very simple. All over the world, in all countries, we share challenges of helping people with disabilities and the elderly to overcome this coronavirus difficulties. So the idea is to share with each other implemented successful projects. So in other countries, we can either learn from them or copy and paste them locally. We are all honored and excited from the amazing reactions and overwhelming registrations from all over the world, and I have no doubt that this will be the first of many. And I invite each and every one of you to contact us if you want to be involved, have a project to share, a technology and innovation to share globally. We will do the best to choose those who are relevant, duplicable, and innovative for us all to learn from. Please note, the amazing speakers we will hear today, I personally would love to hear each one of them for a full hour. Believe me, they have a lot to share and a lot to talk about. But our goal today was to bring it to the surface, the globality of the issues at hand, and to present a gist of recommended innovations. So, if you are interested to send something for the continuation, please let me know. Sorry, I lost the computer. Here I go, every time something like this can happen. So the webinar is closed captioned by Verbit, an Israeli technology-based company. It's based on voice-to-text platform combining AI and human transcribers to provide efficient captioning. And we were supposed to have an international sign language. There was a problem last minute. So we will have American Sign Language here momentarily for the one person that said that they need it. So if there's any problem during the hour, please send a private chat to Tali Ravid, who will help you as much as possible. And in any case, afterwards, you will receive the webinar by a link and with captioning to your emails. So I think you'll enjoy it even later. So let's start. I am very happy to invite Ambassador Aviva Raz-Shechter, Israel's permanent representative to the UN in Geneva, to welcome you all. Aviva, can you see us? Because we couldn't connect at first. Aviva, if you can unmute yourself.
Okay, can you hear me?
Yes, we can. Please just speak loudly.
Very well. So thank you, Michal. And good evening from Geneva. I'm very pleased to be with you today. And dear Ambassador Gallegos and Mr. Wagner, Mr. Pambach, colleagues and friends, at the outset, let me congratulate Access Israel for organizing such a timely event. The COVID-19 crisis has created enormous challenges on the global and national levels. The opportunity to share knowledge and ideas through this platform is therefore very much needed and appreciated. Promoting, respecting, and ensuring the rights of persons with disabilities and the elderly is a high priority for the State of Israel. As a state party for the Convention on the Rights of Persons with Disabilities, Israel is committed to ensure that everyone has access to the same rights. While acknowledging the challenges, Israel is nonetheless investing efforts and thought, together with Access Israel and other organizations, to fulfill the goal and promise of leaving no one behind. Here in Geneva, our mission is very active in different forums, and let me give you a few examples. We are a traditional co-sponsor of the Resolution on the Rights of Persons with Disabilities and support the mandate of the Special Rapporteur on the Rights of PWD. We are also members of the Group of Friends of the CRPD and the Group of Friends of the Charter of Inclusion of Persons with Disabilities in Humanitarian Action. Moreover, we are part of the Task Force on Accessibility and its Group of Friends that works towards improving the conditions of accessibility to the Palais des Nations. In this context, last December, we donated pediatric wheelchairs to the United Nations institutions for young visitors, together with the Wheelchairs of Hope organization. As part of the Geneva routine, we organize and support events that are focusing on disability-sensitive perspectives, such as the use of assistive technologies, education, sports, accessibilities, and many more. This activism and commitment towards CRPD has found its latest expression on the decision of the State of Israel to present the candidature of Ms. Odelia Fitoussi to the Committee on the Rights of the Persons with Disabilities for the elections that will take place later this year. Today, the opportunity to discuss best practices and policies on accessibility and inclusion during the Corona crisis cannot be of more importance and necessity. Persons with disabilities suffer from obstacles every day, but COVID-19 added a completely new layer to consider. The prompt response by governments to try and tackle the crisis created new challenges. The isolation measures imposed by many countries limited the access of the support personnel that assist persons with disabilities in their daily routine. And it has also a serious impact on ongoing treatments and therapies. If normally persons with disabilities may find themselves in a vulnerable situation, this crisis has amplified the difficulties. It is therefore clear that we need to redouble our efforts to ensure that persons with disabilities are part of the discussion, that they are consulted with and included in the discussions before measures and policies are adopted. During these extraordinary days, innovation, creativity, and technologies have a key role to play. They can provide real, quick, and practical solutions for many of the problems. Israel, as a startup nation that is always searching for practical solutions, is standing today as a leader and partner to achieving our common goals. Together with Access Israel and other organizations, we are calling for global cooperation. Together, we can do much better. I'm confident that today we will come out of this discussion more inspired and better equipped to continue fighting for more inclusive society where people with disabilities enjoy and share a bigger part and role in our society. I thank you very much.
Thank you very much. First of all, I must say that I'm seeing who's entering, and the truth is I would like a personal Zoom with each and every one of you guys. Amazing people, amazing organizations, some of which I heard of and some of which I'd love to hear more about. So thank you very much, Ambassador. And again, this is an opportunity to thank the Ministry of Foreign Affairs in Israel that has helped us throughout the years to enhance and enlarge the presence and effect that we're able to do globally, abroad. And I hope to continue this amazing connection. So thank you very much. Now, I was talking about partners, and I'm very, very honored to invite Michael Fenbeck, one of Access Israel's really great friends, who is the director of what I personally consider one of the most important conferences about people with disabilities in the world. I'm a supporter, an ambassador, and a big fan for the last 8 years. Michael, let's hear you.
Yeah, thank you, Michal. So, where the year of this great new model of sharing ideas and innovations, we of course gladly joined in, and thanks once again. We are honored and glad to be part of this. We as the Zero Project see our role, and we are all about sharing innovations and creating meaningful communications, implementations, innovations. But the current model or the last years or before, it's not working. So it was about meetings, it's about conferences, about meetings face-to-face, seminars. So this is all not happening, and actually nobody knows when it's going to happen again, and if it's going to happen again in the old ways, in the old formats. So Access Israel also gives us an opportunity here to enter this new life, to enter this new normal, and we will fully contribute and support Access Israel in developing this. Let me finish my entry statement with two messages. One is we also, as the Zero Project, are fully embracing this new, more digital world and even more digital world. And we are currently developing ourselves new models how to be of service, how the mission of the Zero Project can be fully used again and continue for you all, so for your impact and of cooperating. And we'll see a lot of us from us, what we currently call the digitalization project. So we're fully embracing this new world and these new realities. And my final message is, you see it on the screen, we are already in the countdown mode for the Zero Project call for nominations 2020-2021. It's inclusive employment and ICT. So for the third time, we're looking for outstanding innovations in the field of inclusive employment, vocational training, and ICT. We will launch or call for nominations in roughly 2 weeks. And it will be wonderful if you stay with us, stay connected with us, and finally nominate and share this call. The Zero Project is only as good as you and your nominations are. So this is my final message in our mission. Stay connected with us and support us with nominating and sharing the call for nominations, which is about to be launched soon. Yeah, once again, thank you, Michal, and it's an honor and pleasure to be part of this, and we will fully stay behind you and create new effort.
Thank you. I wouldn't have done it without you guys. So thank you, Michael. And through you, I saw among the participants Martin Essel and Michael Pichler and other amazing guys from the staff of guys and girls from the staff of Zero Project. So thank you very much. And now I'm glad to give the Zoom to the guy that got me hooked on this issue, Yuval Wagner. He is the founder and president of Access Israel. Yuval, please.
Thank you. Hi, everyone. It's great, exciting, and amazing to be with all of you. So I want to say something briefly for this occasion, and it goes like this. In life, we always have two options, right or left, optimism or pessimism, do or not do. I myself was wounded in a flight accident when I was a young pilot. Due to that, I became a quadriplegic, paralyzed from neck down. I couldn't be depressed, but I chose life. I chose to do. I believe that especially from hard, difficult, emergency times, challenging times, you have a great potential for something good, something to improve from. This is exactly the time that we are at now. So that's why we are here together at this webinar, so that we can learn from each other and to improve from this difficult situation for people with disabilities and for people with disabilities. As you all know, the way we live is changing. These are being done, life is being done or we have to live more remotely, doing things more from home, using more technologies. Every country is making plans to adjust to this changing future. So this is, again, a great opportunity for all of us to work with our government to make sure that every new service, every new technology, every change will be accessible and inclusive, and by design, from the beginning, from the start, not retroactively. I want to thank you, all of you, all our friends and partners. I wish you all good health, and I know for a fact that together we will succeed in making life of people with disability accessible and inclusive. So thank you, and enjoy the webinar.
Thank you very much, Yuval. I must tell you that after 8 conferences that we have done, face-to-face, you remember the times you used to meet face-to-face? So after 8 conferences, I was ready for everything that will go wrong. And now experiencing the webinar version of it, it gets your blood bubbling and boiling, because there's new challenges to encounter all the time. So I hope we're going to pass it okay. Thank you very much, Yuval. And now I would like very happily to introduce our keynote, our dear friend, Ambassador Luis Galagos. He is the ambassador of Ecuador to the UN in New York City and the president of the Conference of State Parties of the CRPD. Ambassador Galagos, please.
Thank you very much, Michael. Thank you, Yuval. You're an inspiration to us all. I would like to thank Access Israel. I know of its many, many workings, and I've had the honor of being in your conferences. A greeting to all my friends. I have a huge number of friends on this webinar, and I trust that we will all look into this new phenomenon with the same mixture of compromise and looking into it as a challenge that we must all meet. The era of COVID-19 and the challenges for mankind have brought us to a new stage in world history. First of all, this is the first international crisis that touches on all states, but also touches on every individual. Every human being, all of us, I and you are in front of a challenge of life and death. This had never happened in the dimensions that we are living today. It has changed abruptly the ways we conduct our own lives, the policies of our government, the policies of the world organizations. The threat has meant thousands, hundreds of thousands of people dying and millions of people being infected. And we still have a long road to go. It must be met with that mixture of compassion and, why not say so, with the mixture of the efforts of everyone, with a heavy load in our hearts, but with the mind to conquer this challenge. The pandemic is a life option, like Yuval was saying. Either you do one or you do the other. And we should meet all the challenges with that mixture of a heavy heart, but with a compromise to do this. How has it affected us? It has affected the most vulnerable. It has affected persons with disabilities, 1 billion people with disabilities. It has affected the elderly, another 1 billion people. But it also has affected, as you know, I maintain this position always, those who are with the disabled and the elderly. That means that it has affected a group of 4 billion to 5 billion people who are in dire risk of being affected by this virus. It has also brought up structural deficiencies in all the world, inequity, because the poor have had the brunt of this disease up to now and will have it in the future. 3 billion people do not have access to water. How can you maintain hygiene and wash your hands if you do not have water? It has affected everyone who is sick, everyone who has a health issue. So it has affected all of us. What can we do? First of all, I think we have to promote the protection of the rights of persons with disabilities according to the CRPD. It is a legal obligation for most of the international community. They are bound by what they signed and ratified. We have to have the mechanisms of the UN work on this and guide and promote the respect for human rights, but also the guidelines that must be met by states and non-state actors in relation to these vulnerable groups. The UN has issued documents. The Secretary General has issued a policy brief, the Special Rapporteur on Disability, the Special Envoy for the Secretary General, the High Commissioner on Human Rights, WHO, ILO, all of them have spoken about disability. It is a challenge for everyone around the world. But we must make this multilateral and international issue one that promotes the rights, and we leave this issue, when we leave this issue behind us, we will have a better world. We must look for that as an objective. Governments are our prime responsibility. Their civil societies, their societies in general have to change. The structure of how they look at disability and the policies they apply must be in line with the needs of these vulnerable groups. We look to the people, every individual, because one must look at oneself in the mirror and see how one discriminates against the disabled and the elderly. Being a person beyond 65, I have to say that I have met with the mixed feeling of having to be in a vulnerable group for the first time in my life and feeling the onslaught of the challenge of life and death. Therefore, I look at that mirror and I see all of us, and we must change individually, all of human mankind, to understand this challenge in a profound way in which is affecting all of us. We are here thanks to your invitation to exchange good practices. I, as an Ecuadorian, am very proud because as you know, my president, Lenin Moreno, is a person with disability who has made disability a state policy. Ecuador, with all the limitations it has, looks at this issue as a primary priority in the state's obligations. We hope we can exchange more of those practices with everyone in the world. We must, as individuals belonging to a number of organizations, and I am a member of some of the organizations who are promoting this event, lead the discussion, not to be the objects of the discussion, but have this issue, this rights-based issue as the primary concern of all. We have to not leave anyone behind and have the vulnerable groups decide as they must what they want, because they have to guide the process. I would like to say more. I have a time constraint, but I would like to leave you with the thought that this is the first time we meet in a life and death issue, and it is very profound for each one of us. This is an exercise beyond what we had ever thought. Michael and I have been in many meetings, but never under a subject matter so profound as this. Thank you very much for letting me participate in your organization's webinar, and I wish you the best and the best results, because it will be the results for all of us. Thank you.
Thank you very much, and I have no doubt that this is not the last time we're going to cooperate, and we're going to continue doing good together, and I'm honored to be able to call you a friend. I would like to now introduce you to the first recommended innovation coming all the way from Spain. The innovation is called You Are Not Alone, and it will be presented by Natalia Barrio Fernandez, Director of the Development and Fundraising Unit in ONCE Foundation. Natalia?
Yes.
Just raise your voice and we are waiting to hear it from you. Good luck.
Okay, thank you very much. So, good evening, everybody. Let me start by thanking Access Israel for giving me the opportunity to present to you the ONCE Social Group campaign, You're Not Alone. No estáis solos in Spanish, okay? So, I'm going to start off by giving you a brief introduction to the organizations taking part in the campaign. Then I'll go into more detail on the initiatives developed since the outbreak of the COVID-19 crisis, and I'll finish off with a quick summary of the impact and results of these initiatives. Okay, so ONCE Social Group comprises 3 organizations. ONCE, which is the Spanish National Organization for the Blind, and among other things, it runs the ONCE National Lottery. Union Group, which is the group of companies belonging to the social group in which more than 35% of employees are people with disabilities. And ONCE Foundation, the organization that I represent, which was created 32 years ago by ONCE, mainly to pursue training and employment of people with disabilities and accessibility. So, You Are Not Alone campaign is an emergency action carried by ONCE Social Group to provide attention to blind people and people with disabilities, especially those who are elderly or live alone and due to the coronavirus crisis are in need of greater care and attention. ONCE has put in place primary attention teams in all their operational centers, consisting of social workers, psychologists, and volunteers. In addition, their support service for blind people over 55 years of age who live alone has been reinforced, with the aim of having a follow-up on people's situation and facilitating any kind of support they might need. The Union Group has put hotels from the Union Hotel chain at the disposal of the health authorities, and also has enabled some local administrations to install field hospitals in their cities by providing them with furniture, mattresses, and beds. In ONCE Foundation, we have been concentrating our efforts on responding to the requirements of associations of people with disabilities and their families, regarding medical supplies, food, clothing, and so on. In this context, we have been working together with other private and public entities in the following initiatives. We have been providing personal protection equipment made up of masks, shoe covers, hats, gloves, and protective jumpsuits to associations of people with disabilities to replace supplies in care centers for people with disabilities all throughout Spain, including deliveries with the help of the Spanish Army to the Balearic and Canary Islands. In addition, joining the Coronavirus Makers Initiative, which has allowed us to put our 3D printers at the service of the community to manufacture items, mainly visors that prevent contagion. We have already manufactured and distributed 900 visors to residences for people with disabilities and healthcare personnel. Another initiative is the collaboration with the NGO Urban Angels. We have been acquiring and distributing food for people with disabilities and for elderly people who live alone or who have impaired mobility. The third initiative is that we have been collaborating with the Spanish Health Ministry and with WhatsApp by evaluating and offering usability recommendations to guarantee the accessibility of an app, Spabot COVID-19, aimed at providing basic information about the virus and thus reducing pressure on the health hotlines. Finally, our 850 volunteers from our volunteer unit are delivering not only food, medicines, and so on to people with disabilities and their caregivers, but also moral support in these extremely difficult circumstances. They are an example of social commitment and solidarity. So the results, well, in addition to donations in kind in the form of food, clothes, masks, gloves, as I've said, from large and medium-sized enterprises, we have raised more than 5,000 euros from private donors through our crowdfunding webpage. And we have obtained 235,000 euros in corporate donations. So we calculate that this has enabled us to have a direct impact on approximately 2,000 people with disabilities and then a direct impact on about 3,000 more all over the country. On balance, it's been hard work, but extremely rewarding work, both on personal and professional level. Our aim is to obtain the necessary resources and to maintain the networks to be able to continue helping people until the end of the pandemic. So thank you very much. That's
Thank you very much, Natalia. I know that ONCE, we have been following ONCE for several years, and always it's an inspiration to see the amazing projects that you guys are coming up with and the great ripple effect it's having in other countries. So I hope that now we'll have more. By the way, I didn't mention it at the beginning, but all the presentations that you see here will be uploaded in a website that we will send you a link to after the webinar with contact information. So if you want to learn more from Natalia or from anybody else, you'll be able to do so. Also, for all the speakers, once you're given permission to start speaking, you have control on the slideshow, so you can move it according to your rhythm. So that is a little technicality. And I must thank Maboni Cloud. I just caught you. You're the one showed on my screen with the mask. So you're reminding us, or at least me, where we are and what are we doing here. So I got a great shot of you. It's going to go up on my social media.
Thank you very much for welcoming us. I'm with my friends Solange. We all have Solange. Could you read them? We are from Rwanda. We both have physical disabilities, and we work with the youth with disabilities, children and youth with disabilities in Rwanda. So we joined this meeting for sharing experience about the consequences which was affecting the people with disabilities during this COVID-19. So thank you very much for welcoming us.
Thank you very much. Thank you very much. Now, so thank you, Natalia. And now we have to remember that when we're talking about disability, our focus is not only on the regular, the ones you are, that are visible, like mobility in a wheelchair or blind with a guide dog. Accessibility requires us to think about all disabilities and find the right balance between the needs of the various disabilities. Our next innovation focuses on simple language for people with cognitive disability, but as always, with accessibility, I'm sure you'll be convinced it can be useful for us all. All the way from Austria, Capito Accessible Corona Information. We're going to hear it from Klaus Candusi, the CEO of Atempo. Klaus, please.
Good afternoon to all of you. Let me start with a question. What do you need to make rational and self-determined decisions for your life? For instance, how you should behave in times of COVID. I give you only 1 second to think about it because, of course, it's a rhetorical question.
You're on mute. 1 second, Klaus. Klaus, unmute yourself. Here, now we can hear you. Sorry, Klaus.
Aber ich muss mit der Folie zurück.
Klaus, we can hear you, please.
Yeah, I'll try to go back with my slides. Maybe you can help me with that?
Yes, yeah, sure. We can help you.
Wait. Okay.
Okay, my rhetorical question was what you would need to know how to behave in times of COVID. And yes, it's clear you need information, but not any information. You need information that is valid, that is up to date, and most important, that you can comprehend. If you now consider that more than half of the population does not understand information coming from public authorities, quality newspapers or companies, then you already have got the why behind the Capito project. The problem hereby is not only caused by low language skills of people, but at the same time by the fact that communicators like to write their information on a highly elaborated language so that everybody can see their intellectual capacity. The ability to understand, on the other hand, is individually different and depends not only on intellectual capacity, disabilities, or language skills, but also of what you already know about the subject. And this brings us directly to the two unique features of the Capito method and our technical solution. Capito offers easy to understand information on 3 different language levels, and our Capito app lets you choose the right level of complexity for your individual needs. Of course, fully accessible with read aloud function and sign language videos if you want. At the moment, the work to make information comprehensible for the broad mass is done by our Capito staff. But in the background, we are just beginning to train artificial intelligence in order to do this work automatically in the future. This will reduce production costs massively and allow us to increase our social impact. Capito is a social business and successful on the market in the German-speaking countries, where we established a partner network using the model of social franchising. Let me give you one number to highlight the demand for this kind of service. The daily top easy news, which we developed together with the Austria press agency, started with 3,000 monthly accesses. And actually, reach 130,000 every month. Users of the Capito app automatically get the news on their mobile phone every afternoon. That's another asset, as updates are made in the content management system behind the app. Users never will find outdated information here. So in times of Corona, when safety regulations changes twice a day, you never have to worry if people really have the right emergency plan or not. To sum it up at the end, Capito has market-ready solutions ready to be transferred to other languages and regions. What we are offering and looking for is cooperation. This could be partnerships with social entrepreneurs to scale up the Capito social business model, partnership with media and news providers, and cooperation with companies and public authorities to team up in our AI development project. But above all, our aim is to support inclusion and self-determination throughout understandable information for everybody, at least in these hard times. Thank you for your attention.
Great. Thank you very, very much, Klaus. I must say that the issue of simple and simplified language is more and more visible here in Israel. For all you European friends in this webinar, you probably know and heard that the Eurovision contest last year was the first to be accessible in simple language by the Israeli Institute on Cognitive Accessibility of Agudat Ami and the Ono Academic College, enabling basically people with disabilities to enjoy the Eurovision contest like everybody else. And that is, you know, recreation and fun and entertainment, which is very important. But definitely in the time of the Corona crisis, I think the solution you are presenting here is very important. And thank you very much for sharing that with us. For all those that are chatting and writing me, you're not looking at the camera. It's the human and regular tendency of myself to look at the people themselves, and you are on the side of the computer. So thank you for reminding me. I'm doing my best. So here's to the camera. Thank you very much, Klaus. Okay, now we are back to me. Access Israel would love to share with you guys our project, what we have been working on in the past several weeks with limited staff, but very enthusiastic and dedicated staff. So for the last decade or so, Access Israel has promoted and led training of service providers to turn them into accessible service providers, a practice that has become a law in Israel, where today every service provider has to go through annual training on accessible service annually, and to go also through experiential training, which we believe that making people feel and experience and understand is a key to take the human factor and turn it into a human ramp. When the coronavirus entered our lives, and Israel, like other countries, had to react quickly, we all saw more and more dependency on essential and emergency services, who continued to operate even when everybody else was forced to be at home. A lot of thought was put into how to make sure the services will protect us from virus. Unfortunately, the adaptation of these services to making them accessible was not always on the list. There, we stepped in. First, let's all understand the basics. Second, okay, tabili. Let's all understand the basics. The coronavirus leads to difficulties, stress, and anxiety in the public. We all felt it in one way or another. But we need to remember that for at least 25% of the population, people with disabilities and the elderly, they face even more challenges than the average person. I'm really holding myself not to elaborate on this, but think of the various disabilities and how the stress, for example, can affect elderly and people with cognitive or mental disability. How the masks covering our lips can be a challenge for people with hearing disabilities and the elderly also. How the requirements to communicate from afar makes it difficult for all disabilities, and the extended need for technologies, even if it's not always available or accessible. This is what people with disabilities and the elderly had to face. We have to remember the unique challenges of people with disabilities and the elderly. Often, as Ambassador Galago said, risk groups. People with disabilities and the elderly are considered as part of the risk groups. Technological gap due to lack of accessibility. Absence of support systems. Families, friends were in quarantine, or now they're back in the, trying to get back and catch up on everything. They're less available. Dependency on receiving essentials and being nervous whether they will be received on time. Intensified stress and fear of the corona gear and loneliness that is intensified. All these are challenges that are more unique to this group that we're talking about. What we did at Access Israel was to define the essential service providers. Here it was the police, the healthcare, military, municipalities, volunteers. For each one, we had to understand what the interface is between the services they provided and the public in general. For example, in Israel, the police, who I must say very quickly understood the importance and reached out to make sure that they are accessible, received the task of checking people at home who were quarantined and making sure they didn't leave their houses. The procedure was to ring in the intercom of the building, the bell downstairs, and then ask the person to come to the window or the porch for a visual ID. Now, what if you're hearing impaired and you didn't hear the intercom or the buzz of the bell? Or what if you are paralyzed in bed and couldn't get to the window in time? We needed to step in and break down the process according to the various disabilities and create a guideline adapted to the type of service provided and the type of disability we were focusing on. And there are solutions. There are ways to overcome the barriers. We just needed to take the time and listen to the needs of the people themselves. And the result was guidelines which we translated to English and made as independent from specific laws as possible, breaking down the challenges, ways to identify the problem, and of course, solutions. For medical staff, whether in clinics or remote services, for municipalities and volunteers who in Israel took care of delivering medical supplies or food. How should this be done when the recipient is a person with disability, for example? We wanted to make sure that all these great initiatives are not, can reach the people themselves. Now, again, my computer is giving me some problems, so I apologize. Okay, so what we came up with was customized, generic, easy to follow guidelines on accessible services during and following COVID-19. Now, please note that we, of course, are happy to do webinars and train your personnel on these guidelines, but any trainer can take the guidelines and we will be happy to assist and consult and just guideline and train it to your service providers in your countries. And again, I'm always thankful for partners, and I must say that to this guidelines, we added short video clips that will be able to help and again, appeal to all. One of the partners here in Israel is Asuta Hospital, who all year long does an amazing job with accessibility and leveraging on that human ramp we mentioned before. And they partners with us to create a short video. I'm going to give you just really a taste of it because of the time limitation. But this video, along with others, and of course the guidelines, will be up on the website that we're going to send you guys. Please use it. And you have questions, contact us. We'll be more than happy for you to use it, to share, to pass it on. So please, a gist of the video.
אתה רואה את זה? אתה מצליח לשמוע? אין לי הפרדה.
I think there is a problem with the sound. Okay, so you can stop this now. As I said, this is just a taste, and I'm sorry that there is a problem with the sound. You will be able to hear it full force in the link that we will send you. So you can take down the, great. Perfect. So I would like to thank Michal for this very inspiring presentation. Thank you very much. And now I'm happy to introduce you to Wolfgang Kovacs. No, אני לא רוצה. Can you hear me now?
Yes, do you hear me?
Perfect. Sorry, I understand I spoke and that you didn't hear me. So all I said was thank you to the last speaker and the inspirational project that was presented. And again, I urge you to use it. And now I would love to introduce Wolfgang Kovacs, managing partner of My Ability, another amazing organization from Austria, who will present the, and I hope I'm pronouncing it good, Cocooning, Corona and Cocooning, storytelling campaign. Please, Wolfgang.
Thank you, Michael. Thank you, everyone, that we can take part in this amazing webinar. My name is Wolfgang, and I'm co-founder of My Ability. We're a social enterprise located in Vienna, and we're taking care, and our mission is to inspire and motivate businesses and organizations to be very active and successful in the area of disability and inclusion. We do this with strategic consulting, awareness building, human resource support, and etc. And we are nowadays operating in the German-speaking area mainly, but also starting in countries across Europe. So we are very happy that we have the chance to be here and present our best practice. So if you are so kind and can show the first slide only, please, that would be great. What I will tell you about is our campaign that we started at the end of March. The Corona crisis was already fully present. What we did here is we started collecting stories of people with disabilities in order to raise their voice and in order to also show the public what the special situations and challenges for people with disabilities are. And before I describe it with a few sentences, I will tell you a story. I hope you can hear me well. Is it okay?
Yeah.
Perfect. It's just a slide that is not showing fully, but it doesn't matter. Before I tell you in some sentences about the project and the campaign, I'm going to tell you a story myself. It's only 2 minutes, and I hope we have enough time for that. The story is called More Humanity, Please. I've been chronically ill since my mid-20s. From a life full of dreams and goals, I was torn into a world of bureaucracy madness, therapy plans, existential worries, pain, and thousands of emotions. My interesting profession, the completion of the beloved education, the numerous friendships, and the desired family planning were eradicated without warning, and one is suddenly on the edge of society. In addition, one is to justify and explain the new living conditions which one does not yet understand, and then deal with the critical opinions of others. You feel lonely, excluded, and exposed to barriers that you simply cannot overcome without support. The reason why, after all these years, I suddenly feel relieved, integrated, and normal is you. You out there when you remove barriers and build connections. When the physical distancing, the hand disinfection, the use of delivery services, and many more new things are accepted without evaluation. When doctor appointments can be made via video chat, prescriptions are transmitted directly to the pharmacy and make difficult journeys much easier. When I receive funny and lovely messages on my phone and compassion during bad times. When chronically ill people like me are seen and taken seriously, and there is a willingness to act and help quickly. then you give me not only joy and happiness, but also more space for quality of life and make my world more colorful and accessible in the long run. The current corona situation is terribly sad and difficult, and I feel with every loss, whether through death or through other limitations and changes, I feel you. But at the same time, I thank you all for so much humanity that you are now spreading into the world. I have the heart's desire and the hope that these positive things from this time and crisis, which is also full with opportunities, will be carried on into a better future and with more humanity. So this was the story that a person called Luisa from Austria, 32 years old, wrote on our website, on our campaign site. And this is just an example for the collection of our stories. When you have a look at my screen, maybe you can go back one slide, please. That would be very nice. I'm not sure if it works. What we have done is, together with Story One, that is a startup that collects stories independently of disabilities or not, we opened up a channel that is called Cocooning. And this Cocooning stands for Corona and Cocoon. So this means that I'm hidden, I'm separate at home, and this should be a signal that there is important situations, and these situations need to have a broader publicity. And our goal was to give people with disabilities a louder voice, but at the same time also share optimism. When I, just to finish already, when we have a quick look on the impact, during only a couple of weeks, we collected more than 50 stories, and we gained more than 100,000 views and 20,000 likes from the Story One community. And when we look into the future, our outlook is that we want to mainstream the storytelling with disabilities. We want that these stories are part of a portal where stories are told independently if the person is disabled or not. And in the future, and this is the nicest thing of all, the idea is when you have an interesting number of stories, we will be able to publish books out of those and present these stories that are very important to all of us to a much broader public. This is the plan for autumn, and I invite everyone, at least who speaks German, to contribute. You see the link at the end of the slide, which is ability.org, also Story One /myability, and I'm happy to invite you to contribute to this initiative to give more hope and optimism to the public. Thank you.
Perfect. Thank you very much, Wolfgang. And now, you remember I spoke about partners? So this is one of our first international partners, who I am very, very happy to call a friend, Victor Calisi, Commissioner for Rights of People with Disabilities in New York City's Mayor's Office. And he will be presenting the communication strategy, COVID-19 information and resources. Victor, unmute yourself. And there's no presentation, so we can see your face.
All right, just setting a timer here. Okay. Thank you, everyone. Thank you, Access Israel, for partnering with the Mayor's Office for People with Disabilities here in New York City, and all the presenters before me. I want to say that New York City is the epicenter of the coronavirus in America as we speak, and we are doing a lot to keep our citizens safe. But we'd like to think we know it all, but we certainly don't. And that's how it is important to have meetings such as these, to be able to get the information out, but really be able to communicate things in an accessible format, in accessible ways. So I'm just gonna bring you through some ways that New York City has communicated this to its citizens. We are a city of 8 million, and about 1 million of those are people with disabilities. And we are here to ensure that everything the city does includes accessibility. So if we're looking at our streetscape, or we're looking at our parks department, or we're looking at our cultural institutions, we want to ensure that accessibility is brought forward in every way possible. By doing, with COVID hitting New York City, we really understood that it was important to communicate things to the community. But in order to do that, we had a lot of agencies doing a lot of different things. So we wanted to consolidate all of that information on exactly what was happening with COVID, and we came up with a website. that has all the update information from emergency management, from our food deliveries, from our Department of Health, and we put it in one place. And it is, you can check this out, and I'll send the link out after I speak, nyc.gov/disability-coronavirus. So that was our first line of defense. Then secondly, what we put together was a weekly community call, getting all the advocates within New York City, all the independent living centers, all of the service providers on a weekly call, which happens on Fridays at 1 p.m. Eastern Standard Time. And what we do is we have people from all the city agencies describing what's happening, not all at once, or each week we build on a different agency to let them know what's happening. It could be anything about from how to wear a mask, or how to get testing, or how to get food. So we continue to do that on a weekly call. We ensure that the mayor has information posted that's accessible, meaning that the briefings he puts out are accessible, everything from sign language interpretation to captioning on every single briefing. We have, what we do is, what we communicate to those stakeholders again is food delivery. We have delivered over 265,000 meals a day. We work with our Department of Education to ensure that kids with disabilities and their families get food by teaming up with DoorDash that's been delivering food. We make sure that we work with our transportation system so we can get people with disabilities that need life-sustaining treatments such as dialysis and cancer treatments to be able to have a shared ride system that isn't shared ride anymore, but allows people with disabilities to limit their chances of getting infected. And we have worked with our Department of Education to ensure that accessible e-learning is happening. And along with that, we've put together a document which talks about a guideline for virtual meetings, which I will send out as well after this. So we continue to serve people with disabilities in New York City in every way, shape, or form that we can. We keep adding services from right now. What we're doing, the service that we've had is, or actually have, is collecting information to understand what people need for protective equipment. We've been able to deliver over 100,000 pieces of protective equipment to our service providers, to people with disabilities, to their home care workers, to their personal care attendants, to ensure that they're not going to be infected. And so these are the things that New York City is doing. There is more that we're doing. I encourage you to reach out to me, and I will send information on this call now. I know I can go on and on, but my time is up, and I want to thank everyone for having me on this call.
Thank you, Victor, as always. I really urge, I went through the website and all the materials that Victor referred to, and it's really great, great stuff. And this is what it's all about. Share, copy, paste. We don't have to start inventing the wheel when there's such amazing wheels rolling out there. Now to another great friend who woke up really early for us, all the way from the West Coast, Christopher Patnaud, Head of Accessibility Programs at Google, presenting Connecting the Dots, a proposal on bridging the gap to users. Christopher, I'm always intrigued.
Hi there, how are y'all doing? Thank you, Michal, thank you, Yuval, for inviting me. I've been up since 5 a.m. and I'm glad because it helped us get things ready. But unfortunately, I'm not able to control on Zoom because I'm not allowed to use Zoom.
Just a second, Christopher, and you'll have control in a sec.
But I have to, so I don't have the option to actually.
Okay, so you tell us and we will pass it on.
I'll be your slide.
Thank you very much. Well, and let's move on to the next slide, please. So, hello, my name is Christopher, and I am the Head of Accessibility Programs at Google. But I'm afraid I'm here under a slightly false pretense. I'm not here to talk about accessibility of Google's products. Our products are generally accessible and continue to get better. In particular, Chrome OS, G Suite, and Classroom are important, especially in the time of COVID-19, because of their impact on working from home and education. And for those who are deaf or hard of hearing, and or those who want to have captions for whatever reason, Google Meet is now free with a Gmail account and provides free ASR-based captions in English. Sales pitch over. Next slide, please. So today I am not here representing Google. I came to the idea I want to present because of my work in accessibility with Google, and has been reinforced with a desire to share information with the disability community. There's a common thread that we're hearing of all of the different speakers here of sharing information, and there's something that I have a seed of an idea that I wanted to share. So this is the personal passion project that I've discussed with people I respect and trust, including our friends here at Access Israel, who encouraged me to present it with you. So I apologize, this is not something that you can do, but I'm looking for feedback and I'm looking for people to partner with. Next slide, please. So the world is awash with information. Oh, we can go back. The world is awash with information. Oh, wrong direction. I'll keep going. The world is awash with information, and the faster we move, the harder it is to stay connected. This is an image of dots and lines all being interconnected. The busier we become, the harder it is to pay attention to everything that happens in the real world. Next slide. So when things are moving at light speed, whether you're working at home or working at the office, who do you trust for information? Well, in my research, most people get the information from what I call the 3 C's, from coworkers, colleagues, and conferences. Next slide. This would have been much faster if I was able to click through. Sorry. And there's also a G in addition to the 3 C's. There's a Google here because web search and YouTube are also a significant place where people get accessibility information. Next slide, please. But what happens when information that is shared at a time when people aren't paying attention? There's a TTL, or time to life, in information that is shared today. It only has a finite amount of ability to be heard and a finite amount of time for it to be relevant. So this means if you're not paying attention at the right time, or if you don't have the right system in place, you may miss something that's potentially quite important. Companies communicate in real time, but the trainers and advocates only track when they need something. And the users often want to know, where do we start? Next slide, please. So this is a simple view of the communication participants, and it is really, really simple. At the top row is the organizations who want to share information, and they do it through the groups in the second row who amplify the messages. And then in between, next is a sort of a very subtle gap. And for me, this represents attention and time. The third row are the experts who are the primary targets of the information. And finally, they're the communities whom we are all trying to serve. But what's important is they also help themselves. Next slide. Now, what this represents is a single moment in time. You can see information is being sent everywhere, and it's very, very difficult to have a real impact and have to have your message amplified and heard by the people you're trying to work with. So this is an example of the problem that we're trying to solve. Next slide. And finally, community matters. The people helping people. Who else can answer questions like, what chair is best for playing basketball? Or how do I brush my husband's teeth, who has just become a quad? Or what are the best hearing aids for people over 70? So we have answers for ourselves too. It cannot be just about companies disseminating information. It also has to be about us helping each other. Next slide. So how do we help each other communicate? Next slide. So my proposal is an international, accessible, centralized location where companies can share the latest product updates and insights, which connects the dots between companies, trainers, and organizations into the different communities. It needs to be moderated by experts in the field, but people also have to have the ability to help themselves. And it's also very important that this not be owned or managed by any of the major platform companies to eliminate perceived bias. If it's hosted by Google, people will always assume there's a Google bias, and for this to be useful, that can't be. Next slide. So what I'm calling this is Accessipedia, sort of a cross between accessibility and a Wikipedia. Someone already owns the domain. I'm going to reach out to see if I can get it from them just because, but that's the idea. Next slide. So to do this, there's some significant challenges, and I want to share some of these because this may not happen, but it's important enough. I'm willing to spend my personal time driving this. One of the challenges is organizations, and is because we have to have a significant cooperation amongst organizations who don't always normally play nicely in the same sandbox. And then we'll have the concern of politics in terms of ownership and competing priorities. What's important is to understand how advocacy organizations and companies can collaborate but still keep their identity and keep their relevance. This cannot be successful if it means advocacy organizations will fall. Finally, the content has to be good. We would need to protect the community from misinformation and from people trying to troll the community. And we also need to keep the resources relevant and up to date internationally for this really to work. And finally, there's a significant diversity of needs even within the disability group, because everyone is different. Your situation is different when you are born blind than if you become blind. For example, your needs change, how you need to learn all changes. So we need to create something that can help all of these groups. Next slide. So next steps, I'm going to continue to talk with people and do a listening tour. I've interviewed folks from Access Israel, the AFB, the American Foundation for the Blind, or the American Publishing House, and they think this idea has merit. So I'm going to continue to talk with people. So my first step is to continue to talk and do a listening tour. Is this a problem we can solve? Is this something that's worth solving? And then if the idea is yes, we want to start narrowly, or I want to start narrowly. We need to identify a tech platform that everyone can use, and as an example would be Wikimedia. It's not perfect, but it's a place. And then we would select a single group, a single disability topic, learn the lessons, and then expand. For example, you may start with vision impairments, and then work with the deaf and hard of hearing. And then by working with these two, we can also create a bridge for deafblind and see, can we create something that meets these needs? So this is the idea. I apologize for the ugly slides because I wasn't going to have them until yesterday. But thank you for your time. Last slide, please. If you're interested in participating, or if you just want to follow along, this QR code will bring you to a form where I'm just gathering people's information. I will not automatically gather anyone's email, but please let me know if you want to participate. And this is how we'll start. Thank you all very much. Thank you, Yuval, and thank you, Michal.
Thank you. I must tell you all that when Christopher spoke to me about this at first, my response was, okay, we'll be ready for May 7th. Because I loved it and I wanted it ready to begin. So we will have to wait a little bit longer, but we're here. Anything we can do to make this happen, we'll be very happy to assist.
Thank you.
So I can't believe it, but I'm almost on time, guys. And this is the first for me. For the closing remarks, and I can tell you, my next speaker, that all throughout this session, I've been thinking how you would have done this. And I'm very, very proud to call my friend, the one and only Caroline Casey, the founder of Valuable 500. Caroline?
Well, firstly, there's no way I could have done this any better than you. I think everybody would love me to say a huge thank you to yourselves and Access Israel and to Yuval and Michal. I'm a digital introvert. And I feel it's come from the fact being severely visually impaired and registered blind. It's incredibly difficult to see. But you know, as we were starting this webinar and hearing everybody's voice coming from all the different countries around the world, I actually got really emotional. And for me, it's like, I feel that this online communication is so much less than the physicality. But for this moment at the beginning today and for the last 90 minutes, I really actually feel like I belong to this global community and I'm connected. So that's an incredible thing. So thank you, guys. It's probably the most important piece of what you have done today. Michal has asked me to kind of give a wrap up as quickly as I can about what I see or what we've heard, and then just some kind of clear ideas about how we can go forward. Well, the most important thing that I have heard, and that really came from the ambassador, we need to be leading our own discussion going forward. And this is about collaboration. We know within the disability community globally and in our countries that though we want collaboration, we may not have achieved it. And that has weakened us and has divided us. And I think this particular pandemic is really calling on all of us now to put down our scarcity model, be allies for each other, and collaborate with each other. Because this pandemic has done two things, as the ambassador said to us at the very beginning. Number one, it has shown us the necessity of the work we have done because of the extraordinary overlooking of the needs of 15% of our global population and their families. But secondly, it has also provided us with sort of a weird kind of lie that we've seen systems in some cases adapt very quickly and very readily, such as business, who have argued with us for years about the accommodations for employees with a disability. And now they're proud about their agility. So in some ways we have seen the crisis at its worst and the need for our work, and then the solutions. So what I want to end today with is, no more excuses, guys. No more excuses. Number one, this pandemic has not been the great equalizer. It has been the great expose. Expose of people consistently being overlooked and the inequality, but the expose of what can be done if there is enough will and intention and energy and power and collective collaboration. Number two, we need to be very mindful as this global community that we do not fall back on the old narrative of vulnerability without adding our value. We must balance our need with the huge ability, innovation, and contribution to which we can give the global society and economy to which we want to be self-determining in. And if there is anything more of an example of that, it is the 5 particular conversations and ideas and programs that we have heard. And Christoph, you don't have to apologize for the ugly slides, because we get what you're talking about. And your call for us to help you do that, that is so obviously something that needs to be done. But the connection of all the programs before this are about knowledge, about communicating, and about sharing. And so the third thing that I think when I'm listening to this is we should make it illegal out of this pandemic to have anything but the most accessible communication for all. And so very lastly, I want to say this. This has and is horrible. But let's be honest, people with disabilities have been living on the sidelines for a very long time. And we've had mainstream exclusion. And we talk about collective empathy. Well, empathy is forgotten when the world moves on. But I say to all of us right now, this is the time for our global collaboration, for us to reach into each other and around each other and not in any way leave each other out and say no more excuses. Because many of the solutions that they have needed have come from lived experience of difference. And so to end, difference is normal. This is our time to build upon it. So thank you, incredible Access Israel, all of our friends, for bringing your head and your hearts. We love you very much.
Thank you very, very much, Caroline, as usual. I see that I'm a little off in time, so I will just say really one closing statement, and then whoever needs to leave, you are freed, and I hope to see you in the next webinar. But whoever wants to stay and ask questions to the people who are speaking, you are, of course, more than welcome. Basically, to sum things up, and after hearing the inspiring speakers and seeing the video images of so many people from all over the world, I hope, as Caroline said, we take a twist on the way we look at coronavirus. I have no doubt that I see it now as an opportunity, a reminder that there's no real borders. The challenges we face are faced by others globally, and direct communication and sharing information and best practices. This is something I learned at Zero Project. Again, big fan. This is the way to go. So I hope you enjoyed. I'm happy to see a little chat here and there with great responses. So the success is all of ours together. It's really a collaborative effort, a collective effort. And I really hope to see you all in the next sessions that we will hold in the next weeks. And again, if you have something to share, something you want to talk about, send us the information. We will really try to batch it up to certain subjects and really enable us to share it in the best way. And if I can have a last sentence of commercial, optimistic commercial, I really hope to see all of you guys in person, in the flesh, next spring, 2021, in the Access Israel 8th delayed conference. So guys, thank you very much. And thank you again for all our partners. We couldn't have done it without you. And whoever has questions, what I suggest is, because we are still a lot of people participating here, either write in the chat and Tali will tell me who is asking, or everybody mute themselves. Yeah, everybody, you can, if you want something to say, you can unmute yourself, but I'm afraid there will be a lot of people speaking together. So let's start with the chat and see questions that are coming in. Great meeting, congrats, thanks everybody. Oh, please continue, great question. Caroline, you can just pop in whenever you want. How can we receive the recording of the webinar? Well, everybody who wrote emails, we will send you a recording. Verbit will synchronize the captions, and this is a great opportunity to thank Verbit for their amazing help here and contribution to making this accessible. And again, it can be, it's done not only AI, but also the human factor, helping to make it even better. So Verbit will assist in, once they send it to us, I hope it will be in the next day or two, we will send you emails with link to an updated recording. What other questions do we have here? Well, not everybody at last. If anybody wants to say anything, it doesn't have to be a question. We're still here and you have our attention. So please.
Hello, this is Mohammed from Kenya.
Yes, please, Mohammed. How are you?
Fine. This was a very informative session and I hope to join you other time. Today I was doing most of listening and it was a learning process for me. This was my first. So I'm happy and I hope to join this great team. Thank you.
Thank you very much. And I can tell you that one of our amazing partners is Enable, who does amazing work in Kenya. And I can tell you that they're doing some great webinars focusing on Africa. So if you can write Muhammad's name, and we will send you a link connecting you to Irene, the amazing Irene from Kenya. And I'm sure you will enjoy them also, but don't forget to join us next time also. Who else would like to say anything? Yes, I see that Ong Ko Mint is trying to say, but you're muted. Can we unmute?
Yeah, yeah. I have just unmuted. I am here from India. So it was a great webinar and we enjoyed it. And all the speakers gave a wonderful expression and everything was coming out of the heart and the feelings were expressed were very informative. And we would like to continue have the participation in the next webinar too.
Perfect. Thank you very much. I can tell you that you correctly noticed everybody here was talking from their heart. You have to see them after a glass of wine. It's heart and a lot of emotions, and so it's a great group of people, and I'm happy that you got the vibe. Anyone else, please?
I have a concern.
Yeah, we're talking to Connie?
Yes, Connie. Yeah. So my concern is, as we are moving more and more digital, there are many people with and without disabilities that don't have access to internet and or platforms that they can receive information. So I'm wondering if our foundations and our organizations can work together to make sure that people are actually getting, one, internet, that they can pay their bills to get internet, and two, that they have devices that they can actually connect, whether it's a cell phone or a tablet or something. I think that it's like we're all connected here and it's wonderful, but I think that there are many people that are not connected. In a study in Philadelphia, there are 27% of the population here in Philadelphia that have no access to internet. All the libraries are closed. There are no public venues for internet. So I'm just posing it as a concern that, and maybe for us to problem solve together of how to get people with disabilities, internet and devices to connect.
Thank you. Caroline, you want to answer?
No, I was just saying I completely agree. And I think this is now imperative because we're, as you say, we're sitting here connected. We're the lucky ones. And with that, if we don't deal with this issue, then we are creating further exclusion. So incredibly well said.
Yeah.
Michal, Alan.
Yes, Alan, please.
So I just want to jump in here because we should all actually be packing our bags right now, thinking about coming to where we would have been with Ronnie and Michal and Yuval and Caroline. We would all be coming on, Victor and this whole crew. And, you know, this is a time of opportunity for us. You know, this is day 60 of me being inside of my apartment, you know, worrying about caregivers coming in and out and running out of supplies and the reality of what we are living. This is a time for us to educate others and for us to come out stronger. Caroline, as always, you always nail it on the head. We really, this is our time to show people that the new normal should include us, not leave us on the sidelines. And what Access Israel does, and Google, Chris, what you're putting together, you know, we are a group, we are a family, and the tighter we stay together, the louder our voice is going to be, and the more impact we will make on this world. So thank you guys for all putting this together. I really appreciate it.
Thank you very much, Alan.
Michal?
Alan, for whoever doesn't know, Alan is from the Christopher Reeve Foundation and from Phaser, Friend of Access Israel. Klaus, you wanted to say something.
Yeah, only 2 sentences. Hi, it was an amazing thing to be in this webinar. I really liked it very much. So many people from all over the world. It's an amazing thing. Yeah. But one thing that I have to mention to the speakers that I had before, we are now rescheduling all the economic plans within our companies, our countries. For example, there is a new schedule with 35 billions of euros here in Europe, only in Austria, for digitalization. And I think this would be or could be the big chance for us to involve persons with disabilities from the scratch in the rescheduling. We have to go out to our ministries, to our partners, to our people that we know in the government, and we have to speak with them. And we have to tell them, okay, now it's time. Now it's time to you can see it. Now it's time. You have to involve persons with disabilities, all types of persons with disabilities, and the elderly people.
Thank you, absolutely, Klaus. And I must, before I go to a question here, I just want to say one thing regarding to what Connie spoke about. My first response was to share with you, one of the members of this webinar is Vital Sovirsky, who is a volunteer in Access Israel and deputy mayor of one of the biggest cities in Israel, Kiryat Bialik. And she shared with me that they went out and really handed out tablets and computers whenever possible for people with disabilities and the elderly to connect them. But when I'm talking in a webinar like this, an international webinar, and if it's a lesson that I learned in Zero Project, is that when we are answering the question that you raised, we have to look at everybody. Some countries have solutions, some countries don't have solutions. And what you addressed is basically we have to address this on a global level and really see how to find a solution for that. And this is definitely something that I think we should put and see if we have responses to that from around the world. Another question that was raised here in the chat was in regards to masks. What are you guys doing, seeing in regards to those who are not able to wear them due to disabilities? I can tell you here in Israel, those who due to their medical condition cannot wear it are of course exempt from wearing it. Is there any other policies around the world? Cindy is asking this question. You can unmute yourself if you want to answer. Okay, so basically, I think that is something, I know that I heard it from other countries also. You know what, Ricardo is on board, right? Ricardo is still here?
Yes.
Ricardo? Yes, so Ricardo, in one of the calls you were talking about the purple handkerchief or whatever. It's not the same as the question, but is how do we deal with people who cannot abide to the regulations and rules that everybody else has to abide by? And what do we do about that? Can you share that story with us?
Yeah, so this is an issue. Well, hi everyone, and congrats for the this really good webinar. So this is an issue that came up at the very beginning of the confinement. This whole situation. Centered around people with autism needing to go out with some family member and getting abused at and shouted out by people from the windows and balconies and so forth. Hey, you guys should be at home. We're in confinement. Why are you going out? And so forth. So some people came up with this idea of putting this purple band around their wrist as to indicate that, that it was a very specific situation, that this was a person that's with autism spectrum, and that people that saw them should be aware of this, right? And there were many of these people were actually interviewed on TV and, on the news. So there was a lot of a dissemination of this whole problem that people were not, of course, not aware of, and the way the people from the community have come up with this really simple solution, but still, I mean, it's not totally resolved, right? So not everybody became aware of that, or this is pretty much the problem that we have here. And I guess it's pretty much the same in many other countries, because I mean, how do people know that someone taking a walk in the middle of the day when supposedly they're not allowed? I mean, now we're allowed to go out a bit, for a few hours, but some weeks ago that was a big problem, and even more so when they get abused, getting called all kinds of names by people on the from the windows and the balconies. So yeah, it was a bit of a disgrace. Seeing that.
Oh.
Michal,
you're muted.
You're muted, Michal. You're muted.
You're hearing me?
Michal, you can hear me?
Yes, now
one second. Can you hear me now?
Now
Good.
we can hear
So
you.
I wanted to react to what Klaus wrote and reminding you always look on the full half of the cup and not the empty one. We lost 100 participants, but hey, we finished the webinar and still 120 are with us, Klaus. So that's great. I saw another message here from Dubai saying that over there also people with disabilities with sensory issues have been exempt from wearing masks. Great. And anyone else want to speak?
Yeah, I do. This is Jennifer. I'm in Dubai.
Yes, please, Jennifer.
Yeah. So I just wanted to share with everyone, I don't know if everyone, I know there's a few people that are on here because I see James Thurston and of course, Victor Khaleesi. I've been following the discussions and the excellent information they've shared with the webinars going on with Victor Pineda, with World Enabled and Cities for All. And I would encourage everyone to sort of align themselves with that work that's being done there. This is looking more at policy level. The work that they've been doing for the Global Accessibility Compact for cities, for mayors and policy writers to look at how they integrate ICT, technology, AI, as well as built environment and services to make them fully accessible. But they're also looking at what the pandemic response should be now, but also in the future. And I think that every region would benefit from this. It's a collective effort, so everybody's certainly invited and welcome to participate and contribute information, take information that comes from there. I also just wanted to share that I'm responsible for everything accessible at Expo 2020 in Dubai. And many people are probably aware that that has now been postponed for a year. But the silver lining is that gives me much more time to plan and organize events centered around accessibility, people with disabilities, some that will be conferences, forums, some that will be celebrations and festivals. But we would be looking to be marking World Cities Day on October 31st and hoping that as many participant countries as possible would join in and sign on to that Global Accessibility Compact.
Great. Thank you very much. And I know that Revital wanted to say something.
Yes. First of all, good evening and hi to all our friends from the Zero Project. It's great to meet you all. Dear Caroline, dear Victor, I would like to mention a problem that we dealt with during this crisis, the Corona crisis. Many children with disabilities that lived in institutes were forced to be brought home because the institutes were closed because of the pandemic. And the families dealt with terrible problems bringing these children home without the condition to keep them. And it also influenced the siblings, and it raised a lot of chaos in the family, beside the fact that the parents didn't go to work. So in my town, where I'm a vice mayor, we took care of these families in special care, and we bought them games and tablets, as Michal mentioned before, and sweets, and took special care of the brothers and sisters of these children with disability who were pushed aside because of the problems raised in the family. All this work was done by volunteers in Kiryat Bialik, where I live, and they did a great job. And I just wanted to mention this special deed that our volunteers did.
Thank you.
During the pandemic.
Thank you. Emmanuel now. Emmanuel Nadaisiba, please unmute yourself. Emmanuel? Can you hear us? Emmanuel is not with us. Gavin. Gavin, can you unmute yourself?
I am unmuted.
Hello there, how are you? All the way from Scotland.
Yeah, and the sun is shining in my face, which is very unusual in Scotland.
Yeah.
Hello, my amazing friends. I could not be more proud to be a member of this group. I have a quick question with regards to the possibility for private business to actually spread solutions around the whole world. This is really challenging, no matter how good your solution is, to then take that solution very quickly into other countries. Now, finance is always going to be a challenge with this, but I think one of the things this group can do that maybe no other group could do is helping with mentorship. If there are people out there who work internationally, who understand different markets, if there was a way of getting a group of mentors together who were able to give very good advice for what might happen in 6 months to a year if a company puts out a plan for how it will grow into a market, because all the best will in the world will not get a solution out there unless that solution is copied. And if you're copying it, like you say, it is very much like reinventing the wheel all the time. I have no problem collaborating with other countries and licensing and giving people the head start, but I can't do these things without mentorship because I don't have international experience. So my question is, can this group find a way to bring mentors together to help everyone?
Gavin, thank you very much. By the way, Gavin has one of, I think, the applications that I saw, I think, 3 years ago or 2 years ago in the Zero Project. 2 years ago, and I'm still talking about it. So what you said is noted, and we definitely will see what we can do with that. I'm still amazed that we have 100 participants still. The cleaning lady is here, telling me to start wrapping up things up. But Lisa has been waiting very patiently. Lisa Wrench. So you'll be our last speaker.
Oh my goodness, it's so wonderful. Can you hear me?
Yes, we can.
Oh, great. I miss you so much. It was a joy and an honor and a privilege to be able to tour Israel with you. That is one of the most profound moments of my life. And I just am really happy to be here on this call. As you're aware, we have created video conferencing software to enable deaf people to have communication access. And through many years of working with cities and government officials, we actually have had cities and police create accessibility across their whole city, their whole police department, to be able to work with deaf people. So since 2017, when I was in Israel with you, some of the brilliant CEOs worldwide that are friends of mine and I got together and said, you know, you have these patents on video conferencing technology. You've spent a lot of money donating to create accessibility for deaf people. Let's do some projects that will extend this into video, into medicine and education. Those are really two places where we could make a tremendous impact. So at the end of last year, we started extending our video conferencing solutions into an educational platform in medicine, and then COVID hit. I am really profoundly troubled by the situation we're all in, but at the same time, we have business people and entrepreneurs and people who have worked helping to help countries heal after 30-year worldwide civil wars and things like that, who are actually grouped together in a project called MyMedio. And we're taking our video conferencing software and making it intelligent enough so that doctors can collaborate worldwide, educators can collaborate worldwide. So a doctor in Israel at 4 o'clock in the morning could help treat a patient all the way across the world for free. And the intelligence to be able to do that is built into this software. a gentleman over in Asia who puts in the internet and cellular phone systems in his country is part of that project. A gentleman who worked to help end a 30-year civil war in his country now lives in the United States. He's our chief community engagement officer. A gentleman who owns a company who is creating battery charging stations for intelligent electric cars is helping design the software. So truly, this project is a commitment by business people to leverage their technology and their education and expertise to make a difference for vulnerable people worldwide. So I would encourage anybody on this call, if you need to leverage networks, if you need to leverage funding, if you need this kind of technology to do what you do, please get in touch with us. I will put you in touch with the people on our group. We're helping people who are homeless, who are affected by the virus. Truly, this is an incredible opportunity. And this call and what Access Israel does is a prime example of people getting together and saying, come, let us get together and make a difference, one conversation at a time. And that's what we're about. So I'm so grateful to be here. If there's any way we can help or collaborate, please get in touch with me. We're so grateful. And please encourage and support us any way you can to get these products out there. We want to see medicine and education going forward.
Perfect. Thank you very much, Lisa. Jamie,
you're welcome.
And I think, Lisa, that we will have you on in one of the later webinars. You definitely have a lot to share here. Jamie?
Yeah, good morning from, oh no, it's already good afternoon from New York. And I do apologize to the cleaning lady. She is a lovely woman, but I felt I wanted to say something. I live in the United States, in New York, where our COVID committee of the president can't come out with a solid answer as to what is coming next, what is happening today, what is happening tomorrow. And what I learned today surpasses what I do. His Excellency Ambassador Galagos, Victor, and of course the always well-dressed Caroline, thank you for your heartfelt comments. The information provided by the others was extremely informative. And of course, to Michal, Rani, and Yuval, kol hakavod, as we say, to you, all the glory. Kudos for this incredible work that we are so proud and humbled to be part of. Now, moving forward, this global seminar was very helpful. And now we have to move towards our goal of making sure that no one, absolutely no one, is left behind. And if there is one group that can get this done, it is not a government organization, it is not a president, it is the group that joined this incredible webinar. When I mean incredible, I mean heartfelt. We are all links in a chain, and we just have to work hard together as a group with these webinars to make sure that no one is left behind. Thank you, Michal, and apologize to the cleaning lady.
Thank you very much. Guys, if now so late after we started, I still have about 100 people and people are apologizing that they're leaving, I guess we did something good today. So thank you very, very much for participating. A lot of questions are, will there be follow-up webinars? Yes, they will. After today, absolutely. Write to us. We will get in touch with you next week with a link to the webinar, and let's continue to do good together. Have a great, great morning, evening, night, afternoon, wherever your time zone is. And before I leave, thanks a lot to the amazing Tali, who is by my side. You don't see her. Tali and Tuvia, who have been the force behind us and enabled this amazing webinar. So Tali, thank you very much. Bye-bye, guys. Enjoy.
Bye-bye. Bye.
Bye. Bye.
Amazing.
Bye from Austria.
Bye-bye.
Bye-bye, all from Spain.
Bye, Michal from Spain too.
Bye.
Bye from Cyprus.
Ken from Austria.
Bye. Emmanuel from Rwanda. Sakura.
Emmanuel, we miss you. We wanted you to speak before next time. You have to join us.
Bye, James from Kenya.
Bye from Cyprus.